Okay, our presentation was on workplace violence, and in our group was Amber Hartman, Carrie Godridge, and Marissa Morgan. Okay, healthcare workers are 4 times more likely to experience serious workplace violence. What is workplace violence? It is any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the worksite. Why is this a problem? It's severely unreported. 50% of physical assaults and 80% of verbal assaults are unreported. Healthcare workers make excuses for patients, and they don't want to make them the enemy. How does this affect nurses or patients? This can literally be life-changing to nurses that are assaulted or those who witness it. Many nurses leave the nursing profession as a result of workplace violence, emotional and mental trauma to both the patient and the nurse. What is the history? So how did this become a problem? It has been missed for a long time because corporations don't focus on potential hazards to their workers. Historically, the focus has been on patient safety and not healthcare worker safety. Many healthcare workers consider patient violence as part of the job. In the past, injured nurses have been told to accept violence in the workplace and move on. How does it negatively affect quality of patient care? Physical and verbal threats and attacks can cause physical and psychosocial effects, causing medical errors, poor patient outcomes, caregiver burnout, job dissatisfaction, and increased turnover rates, and moral distress. Who has been or will be affected by this problem? The main people who are affected by workplace violence are the caregivers that give direct patient care, are at the bedside, and go into patient rooms. Healthcare workers in any setting are at risk for being injured, especially those that work with people who have a history of violence or who may be delirious or under the influence of drugs. Okay, so some alternative solutions or potential policy possibilities, some communication strategies. So we could establish rapport with your patient to build trust, actively listen to your patient's feelings, be attentive to nonverbal communication like body language and facial expressions, give the patient control of certain situations, and be aware of patient triggers. So if the patient's going through alcohol or drug withdrawals, patient expectations aren't being met, perceived loss of control over situation, or a history of abuse. But always make sure that as the caretaker that you're taking care of yourself if you're assaulted. Okay, policy changes, outcomes, or goals. So what are your intended outcomes for the proposed change? Our intended outcome for our change is to protect our healthcare workers, nurses, doctors, CNAs, respiratory therapists, etc., to the best of our ability. We want to implement certain ways and tips for healthcare workers to protect themselves and avoid ways of finding themselves in dangerous situations. Workplace violence is the highest in healthcare as compared to any other industry. We need to change this so that our workers can feel safe at work. The rate of serious workplace violence incidences was more than 4 times greater in healthcare than in private industry on average. In fact, healthcare accounts for nearly as many serious violent injuries as all other injuries combined. Okay, how will this change affect patient care quality? These instances put both patients and nurses at risk, so these changes will help better their care and keep them safer. By making this issue more well known, it will make patients and staff more aware that it is happening. The reactions of victims to bullying or workplace violence may decrease clinical care outcomes and patient safety. How could this change affect the existing policy? We want to take away the thought that violence is part of the job in nursing. As healthcare workers, we need to protect and take care of ourselves as well as our patients. How likely is it that those in charge would agree to this proposal? Many managers and higher-ups put a large emphasis on minimizing workplace violence, so there would be no trouble in implementing changes to break the taboo on the subject and keep it from happening. Is it ethically acceptable? This problem is something that affects both healthcare workers and the patients, so it would be very ethical to try and do something to minimize it or change it. Final recommendations or change. Some changes that we thought up to help decrease this is bring more awareness on the subject for patients and staff members. Set barriers and restrictions for patients. Ensure staff should first protect themselves if they are being threatened or feel threatened. Make sure that there's adequate staff and backup if there is a known violent patient. Encourage staff to report all instances of workplace violence. How would you evaluate the success of your recommendations? Determining if more people are reporting their instances, so less part of the job stigma, and then if there are fewer actual incidences occurring and less nurse burnout. Discuss how nurses could be part of the situation. Nurses are the largest part of this solution. We need to report when it happens and talk about the stigma, and discuss the issues and barriers with our patients and coworkers. And then make sure that we're supporting staff that have been involved in these situations. And here are our references.